Hello everyone, we are discussing regarding the causes of the diarrhea. You can remember the causes of the diarrhea as a diarrheal, mnemonic. Now the D for drugs, I for irritable bowel syndrome, A for autoimmune causes, R for rapid transit, R for renal failure, H for hypersecretory causes, E for endocrinal causes, A for absorption related problems, and L for lesions, means neoplastic lesions. Now, in a drugs, D for drugs, laxatives, antibiotics, colchicine, and digoxin. You can remember another D for diarrhea is diverticulitis. You can remember another I for the diarrhea is infarction of bowel. You can remember another I for the diarrheal causes is infectious causes. In infectious causes, viral diarrheas are the most common ones. Bacterial causes are Salmonella, Shigella, Campylobacter, Yersinia, Clostridia difficile. Toxins related diarrheas are related with infections are Staphylococcus, cholera, botulism, E.Coli, and Vibrio cholerae. Now, protozoas causing the diarrhea are Giardia and amoebiasis. Immune-related causes are acquired immunodeficiency syndrome. A for autoimmune causes. Autoimmune causes are ulcerative colitis, Crohn's disease. And another A for diarrhea is appendicitis. Rapid transit is dumping syndrome. Hypersecretory causes are Zollinger-Ellison syndrome. Endocrinal causes are hyperthyroidism, diabetes, and Addison's disease. Absorption related problem is pancreatic insufficiency. Now the diarrhea related with the cholinergic crisis. That is, you can remember with the sludge mnemonic. S for salivation, L for lacrimation, U for urination, D for diarrhea, G for gastric upset, E for emesis. Another one is the organophosphorus poisoning. Organophosphorus poisoning is one of the type of the cholinergic crisis. Now, cholinergic crisis you can remember as alternative mnemonic. Dumbbells, D for diarrhea, U for urination, M for meiosis, B for bradycardia, B for bronchospasm, E for emesis, L for lacrimation, and S for salivation. Now, enteroaggregated E.Coli causes the persistent diarrhea, and that is related with the heat-stable enterotoxin EAST1. You can remember that as the aggregate means persist, means enteroaggregated diarrhea causes the persistent diarrhea. Now, enteroinvasive diarrhea resembles the like shigellosis, and shigellosis detected by the Serine test means penetration of the HeLa and Hep2 cells. You can remember as invasive diarrhea means H2S2 invades like shigellosis. Now, enteropathogenic E. coli and enteroadhesive E. coli attaches to the enterocyte membrane in infant and children. These diarrheas are associated with epidemics. You can remember as infant attaches and for epidemic in patho. Now, enterotoxigenic E. coli causes the traveler's diarrhea, means T for the T produces the enterotoxin, either a labile enterotoxin or stable enterotoxin. Now, other than diarrhea, the conditions associated with E. coli are UTI, neonatal meningitis, and gram-negative sepsis. UTI means urinary tract infection. You can remember the condition caused by the E. coli are as dung. D for diarrhea, U for UTI, N for neonatal meningitis, and G for gram-negative sepsis. Now, E. coli causes the enterohemorrhagic condition known as a hemolytic uremic syndrome. Invasive E. coli causes the immune-mediated inflammation and causes the diarrhea. Enterotoxigenic E. coli causes a traveler's diarrhea. T for T, I for I, and H for H.
Okay, here we are going with the diarrheas with the cytotoxic drugs. They are associated with the bone marrow suppression, alopecia, and hyperuricemia. You can remember BADH, but related with the cytotoxic drugs side effects. Now, the diarrheas related with the hyperthyroidism. You can remember it as a thyroidism. T for tremor, H for heart rate up, Y for yawning fatigability, R for restlessness, O for oligomenorrhea and amenorrhea in females, I for intolerance to the heat, D for diarrhea, I for irritability, S for sweating, and M for muscle wasting and weight loss. Now, diarrhea is associated with the lead poisoning, presented as A, B, C, D, E, F, G. You can remember as a mnemonic. Now, A for anemia, B for basophilic stripping, C for colicky pain, D for diarrhea, E for encephalopathy, F for foot drop, and G for gum related with the lead lines.
Now, diarrhea is associated with the carcinoid syndrome. The components of the carcinoid you can remember as a carcinoid. CARC. C for cutaneous flushing, A for asthmatic wheezing into the lungs, R for right-sided valvular heart lesions, C for cramping and diarrhea. Now, diarrhea is associated with the celiac sprue. The features of the celiac sprue you can remember as celiac, CELIAC, C for cell-mediated autoimmune disease, E for European descent, L for lymphocytes in lamina propria, means lymphoma risk, I for intolerance of the gluten. Gluten is present into the wheat. Wheat is a cereal. A for atrophy of the villi in the small intestine. Abnormal D-xylose test. C for childhood presentation. Atrophied villi cause less absorption into the gastrointestinal tract. So, diarrhea, weight loss, less energy is associated with the celiac sprue. Now the diarrhea is associated with the vitamin B3 deficiency. Vitamin B3 means niacin, means nicotinic acid, and the condition is caused by the vitamin B3 deficiency is pellagra. You can remember it as a 3 Ds. Means pellagra means D for dermatitis, D for diarrhea, and D for dementia. Now the diarrhea is associated with the blood. Mainly the causes are the infectious ones. Infectious causes for the bloody diarrhea you can remember as CESSYECH. Means C for Campylobacter jejuni, E for E.Coli, means enterohemorrhagic strains, S for Salmonella, S for Shigella, Y for Yersinia enterocolitica, E for Entablema histolytica, and C for Clostridia difficile.
Now, the Clostridia difficile causes the explosive foul-smelling diarrhea, and Clostridia difficile are the anaerobes, and anaerobes don't require the air for the growth. Now, the antibiotic-associated diarrheas are the caused by the Clostridia difficile bacteria. And Clostridia difficile bacteria are anaerobes.
Now, the digestive disorders are associated with pH levels. pH comes up into the vomiting. In vomiting, food comes up. You can remember as pH comes up and food comes up into the vomiting. Second one thing is the diarrhea. Diarrhea comes down, means pH also comes down into the diarrhea. You can remember as D for diarrhea, D for down, pH and food comes down. Now the diarrheas are associated with the dehydration, and dehydration is associated with the fluid loss from the body. Fluid loss of the 1 ml is equivalent to the 1 gram fluid loss from the body. In dehydration, there is a decreased capillary refilling time, depressed anterior posterior fontanalis onto the top of the skull. Dehydrated means dry mucous membranes in oral cavity and in other systems of the body. Cold hands and cold feet. Voiding of the urine is decreased into the diarrhea, dehydration and vomiting. Now, dryness of the mouth into the diarrhea. Dryness of the mucosa of the mouth. You can remember as DRI. Differential causes of the dry mouth. DRI. D for drugs or dehydration. R for renal failure or radiotherapy. I for immunological cause, Sjogren's syndrome. And I for intense emotions. Thank you for hearing us in this discussion of the diarrhea, dehydration of the gastrointestinal tract and other systems. Please like, share and subscribe our YouTube channel Medico World. Thank you.